Hi, I want to take a moment to speak to you today about leptospirosis, which is a serious public health concern. And first, I want to start by reading a quote from the CDC about leptospirosis. Leptospirosis is a bacterial disease that affects humans and animals. It is caused by bacteria of the genus Leptospira. In humans, it can cause a wide range of symptoms, some of which may be mistaken for other diseases. Some infected person, however, may have no symptom at all. Without treatment, leptospirosis can lead to kidney damage, meningitis, liver failure, respiratory distress, and even death. Okay, first I want to start with the main routes of exposure. The bacteria are spread through the water, the soil, and contaminated food that contains the urine of an infected animal. Like for an example, like raccoons or lots of woodland creatures are the first ones that usually come to mind. The Leptospira bacteria can be absorbed through mucous membranes and the contaminated water. Health impacts on humans. Unfortunately, many of the symptoms of lepto are similar to other diseases. Same thing goes for animals. It's very difficult to diagnose leptospirosis in animals because a lot of the symptoms are the same as other diseases. There's two phases of infection. The first phase of infection begins with the fever, chills, headache, muscle aches, vomiting, and diarrhea. The second phase, sometimes they call it the Weil's disease or Weil's disease, can be more serious, and it might even cause kidney or liver failure or meningitis even. For the life cycle, the bacteria will enter a host, migrate into the bloodstream and the lymphatic system very, very quickly. The scary thing that I did learn was within a few minutes of the blood sample being drawn and read, it'll show evidence of the Leptospira. The bacteria reproduce, and within 8 hours, their numbers are doubled. And at this point, the patient might start showing signs and symptoms. The illness can last from anywhere for a few days to 3 weeks or more if it's not treated. Diagnosis and treatment to protect human health. It can be treated with antibiotics if given in phase 1, right at the very beginning when there's the fevers and chills at the very beginning stages. If they enter into phase 2 and it's more severe, they're probably going to have to do intravenous antibiotics to get directly into the system a lot quicker. The last thing that I want to talk about was the drinking water treatment. How do we treat the drinking water? Disinfecting your drinking water for personal use is pretty easy in this case if it did have the Leptospira bacteria in it. You can boil the water for a few minutes for small volumes of water, like putting it in a pot, on the stove or over a fire pit. There's also iodine tablets that can be added to water for purification. Neither of these treatments is effective for the large water supply, though, like ones that you would use for your home. So the only ones that would be the best for that, they said, would be UV sterilizers, and they can be used for large water supplies. And thankfully, in those ones, there's no chemicals that are involved in that treatment. I hope you found this informational and you learned something. Just remember that leptospirosis can affect both humans and animals. It's a zoonotic disease, and that there are ways to protect yourself and your pets from obtaining it. And just keep your eyes open and keep reading. Thanks.